I am Dr. S. Vijayalakshmi, Assistant Professor Neurology, Pushpagiri Institute of Medical Sciences and Research Center. I'll be talking about epilepsy. So, epilepsy is a neurological condition that affects the brain. It is a tendency to have repeated seizures. The tendency can be of long term or it can be for a few time only. So, a person can have epilepsy but still have no active seizures. What exactly these seizures are? As we know, the brain is the integral part which controls all our body movements. For that, the brain is equipped with cells called neurons. These neurons, they transmit through chemical messengers. So, any misfiring of this chemical messenger that can lead to seizures. So, seizures are due to the abnormal electrical activity within the brain. So, whenever a patient may get a seizure, he or she will be brought to the hospital. So, it is the first episode of seizure. At that time, the doctor may not start the patient on a medication and he will not be labeled as having epilepsy because it is the first episode of seizure. He or she may not have a further episode, will be seizure free for lifelong. In that case, he or she will not be labeled as having epilepsy. Whereas, if a patient is having more than two episodes of seizures, he or she may be labeled as having epilepsy. Certain cases, when the patient has only one episode of seizure, still we start medication. This is because their tests, that is electroencephalogram, EEG, CT, or MRI, may be abnormal, or the clinician seriously think that he or she has an underlying problem and there is every possible chance for a seizure recurrence. Then we call it an epilepsy, where the patient needs lifelong treatment. But the patient can be controlled and he may have epilepsy but no further seizures or no active seizures because of these medications. So, some of the people, they may be having more than two or three episodes, they'll be on medication, they may stop the medication, still they get seizure. These patients, they require treatment for lifelong. Now the question is, when will we diagnose we have epilepsy? That is, as I have told, more than two episodes, the patient will be labeled as having epilepsy, or the patient have a genetical or clinical condition which shows strong cause for recurrence of seizure, then also he or she will be labeled as epilepsy. Now, what all things are important in a case of epilepsy? The most important thing is that the account of the witness. So, whenever a patient gets seizures, the witness account, how the semiology is very important. You can record a video and you can always ask the bystander to have a video recording during seizures. That is very important to know which type of seizures and what all medications we should be given. So that, and the patient should be taught about the precautions which he or she should have. So, in about 50% of cases, whatever we do, we may not get a cause for epilepsy. It is known as idiopathic seizures. So, in the case of seizure, the most important part is about the account detailing by the witness and the video. Thank you.